everyone, my name is Chinalyn Himawan and I will going to talk about taping and wrapping in the prevention and treatment of athletic injuries. So, the primary purpose of taping and wrapping is to provide additional support, stability, and compression for an affected body part. Taping can be used as a preventive measure or as a protection for new or healing injuries. Athletic taping is the process of applying tape directly to a skin or over pre-wrap in order to maintain a stable position of bones and muscles during athletic activity. It is a procedure that uses athletic tape attached to the skin to physically hold muscles or bones at a certain position. So some of the examples of taping materials or supplies are: first is spray adhesives, second is underwrapped, third is tape, fourth is foam paddings, and fifth is tape removal tools. But I would like to remind you that before you apply tape and wrap, you have to make sure that you are certified athletic trainer or team physician with a full, complete assessment of the athlete's injury. Athletic tape is made to be torn easily by holding firmly on each side and pulling at an angle so the force breaks the fibers. Tape underwrap helps eliminate irritation from repeated taping while providing comfort for the athlete, holding heel and lace pads in place, and keeping tape away from the skin of those athletes that is allergic to tape. Spray adherent helps the adhesive tape and underwrapped adhere to the skin. The purpose of taping is to help to increase blood flow in the injured area. Athletic tape decreases swelling, which alleviates pain. The elasticity of the athletic tape can also serve as support for the affected muscles. It naturally goes back to its original position, which takes some of the workload off the athlete's muscle. Heel and lace pads help prevent pinching and blistering in friction-prone areas and are with a lubricant ointment. While tape-removing tools include specialized scissors and tape cutting devices designed to slip under the tape and underwrap. They quickly slice through the tape without irritation to the athlete. Prophylactic ankle taping has been the mainstay to prevent of ankle injuries. Proper ankle taping is generally understood to reduce plantar flexion and inversion of the ankle, and this has been shown to be the most common mechanism associated with ankle sprain injuries. So, in short, prophylactic taping is a preventive technique used for the protection, stabilization, and care of athletic injuries. Some of the common type of ankle injury is an inversion, which means it is a turning inward of the muscle, and the second one is ankle sprain, which is the stretching or tearing of a ligament. Another example of taping is low dye taping. It helps to improve foot biomechanics by keeping the athlete from overpronating or foot rotating inward. The third one is torf tooth taping. Torf tooth taping is also called metatarsal phalangeal joint sprain. Can occur after a forceful hyperextension of a big toe, causing damage to the ligaments and joint capsule. The next one is the Achilles tendon, also known as the largest tendon in the body, joining the lower leg gastrocnemius and soleus muscles to the heel bone or calcaneus. The next one is shin splints or medial tibial stress syndrome. The sixth one is wrist taping. It adds support to the wrist. The seventh one is thumb taping. It is a simple method to keep the thumb from hyperextending. The next one is finger taping. Its support can be obtained from a simple body taping procedure. The last one is elbow taping. Taping prevents hyperextension and prevents hypermobility. A compression wrap is a bandage made of elastic. When should you wrap an injury? Use a compression bandage for only the first 24 to 48 hours after an injury. Combine rest and elevation with compression whenever possible. Another types of wrapping is groin wrap. Groin wrap uses a specialized wrap design for this area to help with rehabilitation and recovery. The next one is hip flexor wrap. Hip flexor wrap is identical to groin wrap except that it goes in the opposite direction. The last one is thigh wrap. Thigh compression wrap can help control the extent of bleeding within the muscle, common when the athlete receives a severe blow to the thigh. To sum it up, the purpose of taping and wrapping is to provide compression to minimize swelling in the initial management of injury. The importance of taping and wrapping is to commonly use as an adjunct or temporary technique. Athletes often make use of taping as a protective mechanism in the presence of an existing injury. Some of the goals of taping are to restrict the movement of injured joints, soft tissue compression to reduce swelling. Once again, my name is Jenaline Bayubay-Humawan, and I would like to remind especially those future PE teachers, trainers, coaches, sports medical team that it would also be nice and practical if you have a certificate consisting of full assessment and the credentials to be qualified as first aider. That's all, and thank you. I hope you learn and enjoy my video presentation about wrapping and taping. That's all. God bless us all. Thank you.